My name is Darrell Hines. I'm 30 years of age and I'm a stroke survivor. I went into a coma for 3 weeks. I woke up in James's Hospital 3 weeks later and they said I had a stroke. I was going to be there for a while, they said. I don't drink, I don't smoke, I don't do drugs. It still happened to me. And I started crying in the hospital and I was like, why me? I started rehabilitation in the early days in James's Hospital, and it's January 2022 now, and I'm in the NRH Dunleary, and I think I'm going to be okay.
How are we in Ireland compared with other countries in terms of rehabilitation services? Well, I guess we're probably very far behind other countries like the UK, even throughout Europe and North America. So comparable countries in terms of development, we are very, very far behind. At the moment, we have 11 whole-time equivalent rehabilitation medicine consultants working clinically in this country.
It starts with like occupational therapy. You don't know what's going to come back when, if your arm will come back before your leg or if you'll have a disability for life. So they train you to be independent with the disability. So occupational therapy focuses on the aspects of your everyday life. It's really hard, but it's worth it, you know.
The gaps then that we have in this country, they're across the board. There are certain conditions like progressive conditions that there are really, really poor rehabilitation services for a lot of those patients. So maybe people like with MS or multiple sclerosis, they would typically be cared for by a neurologist, but often there are no teams of therapists and specialist nurses to look after those patients.
When I first visited home and I took my first step, my mom cried because she knew that they were going to fix me.
If we can give people good quality care and enough of it at the right time, ultimately that will improve the independence of patients with an acquired neurological condition.
I have a great team behind me, like my parents, friends, everyone. We're all a team.
If you can rehabilitate patients, get them through the hospital system, get them back into their own communities, you're freeing up beds in acute hospitals for patients who really need them for medical and surgical conditions, or you're freeing up beds in an inpatient rehabilitation facility for the next tranche of patients who need that level of rehabilitation. So in terms of the health service, if we had adequate rehabilitation services, it would hugely improve patient flow, get patients out of hospital back into their own community.